Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're focusing on seasonal affective disorder, also known as SAD, a condition where depression comes and goes with the seasons. Most often, people feel worse in the fall and winter when days are shorter and the sunlight is scarce. To help us understand what causes it, how to recognize the signs, and what new treatments are emerging, I'm joined by Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine. Dr. Henderson, welcome.
Well, thank you. It's a privilege to be here.
What exactly is seasonal affective disorder?
It's a mouthful, isn't it? Seasonal affective disorder is a form of depression. It follows a seasonal pattern, typically beginning in the late fall or early winter and improving in the spring or summer. People often feel low energy, sadness, and irritability or sleep disturbances during these darker months. It's not just winter blues. It meets the full criteria for a full major depressive episode, but with a very clear seasonal trigger.
Are there different types or stages of seasonal affective disorder?
Yes, there are. The most common is the winter pattern, SAD, marked by hypersomnia, that means sleeping too much, carbohydrate cravings, weight gain, and social withdrawal. And less commonly, there's the summer pattern, SAD, which presents almost in the reverse. People may feel restless, anxious, and have insomnia and eat less. These forms fall under major depressive disorders or a bipolar disorder with a seasonal specifier.
What usually causes it?
It's multifactorial. The major factor is reduced sunlight, which can disrupt our internal body rhythm. It's called a circadian rhythm. That affects the production of melatonin and serotonin, the key regulators of mood and sleep. Other contributors include low vitamin D, a genetic vulnerability, and possible dysregulation of the brain stress system.
Is there a genetic component to this?
Absolutely. You see it in families all the time. Family and twin studies demonstrate that as a heritable component. Genes related to serotonin transport, circadian regulation, and light response systems have been implicated. The specific gene is linked to neurogenesis and circadian behavior. It's also emerging as a possible contributor.
What about early developmental or embryologic factors?
Interestingly, SAD does not appear to be rooted in embryological development. Unlike some congenital conditions, it's more tied to genetic and evolutionary factors that become relevant later in life. For example, in ancestral settings, conserving energy during darker months may have been adaptive. So while we're not born with SAD per se, you may be born with a circadian sensitivity that gets triggered by environmental changes.
How does traditional Chinese medicine view seasonal affective disorder?
TCM looks at SAD as a disharmony. In other words, you're out of balance again between the internal key and the external seasonal cycles. During winter, the yang energy naturally declines. And if a person has kidney yang deficiency, it can result in symptoms like fatigue and depression and low motivation. TCM treatments include acupuncture, herbal formulas, and even moxibus to warm the kidney yang and regulate mood.
How is seasonal affective disorder diagnosed in your office?
It's diagnosed clinically. A person must meet the criteria for the major depressive episodes that recur at the same time of year for 2 consecutive years or more and fully remit during the other seasons. You may use tools like seasonal pattern assessment questionnaires, which is a screening tool that assesses seasonal changes in mood, sleep, appetite, weight, energy, and social activity. The most important step is taking careful seasonal histories.
What are the standard of care treatments now in the United States?
There's really three pillars. What light therapy is amazing, and it's very commonly used with good success. It's 10,000 light boxes every morning for 30 to 60 minutes because that resets our circadian rhythms. Pharmacotherapy, selective serotonin reuptake inhibitors such as fluoxetine and other antidepressants are commonly used and effective for treating SAD. Cognitive behavioral therapy for SAD, they call it CBT, help patients manage negative thinking, especially around winter, and maintain structure. Vitamin D supplementation is added, especially in deficient individuals, can be a maintenance dose of 1 to 2,000 international units per day.
Let's talk about that vitamin D. We're living in California. People are out in the sunshine. You do a vitamin D level and it's low. Can you please explain the oxymoron of that to me?
Sure, the vitamin D itself is utilized by bodies, by your genetic factors. So the utilization of it varies. And it's not just being in the sunshine, it's what you're doing when you're not. And so if you're not expending it, A, D, E, and K are the four fat-soluble vitamins, right?
Yeah.
So it is built up in the body. And when you see a low D, you know that you've got to replace it.
All right. So let's talk about regenerative or emerging treatments that are showing promise in your office.
Well, thank you. That's exciting for sure. Neurofeedback, real-time brainwave feedback to train mood-related networks is absolutely effective. It shows benefit for the depression, and it has many variations. The acetyl L-carnitine, which we abbreviate ALC, supports mitochondrial energy and mood regulation as an intravenous therapy, and it's extremely successful. Tryptophan modulation, which is a dietary boost of serotonin synthesis, is in the gut microbiome and can influence that pathway. B-complex vitamins, those are all water soluble. They support the neurotransmitter synthesis. These therapies are adjuncts, not replacements, but they align with SAD's biology.
What lifestyle changes can help these patients?
Several. Exercise, preferably outdoors or in bright light. Diet, a Mediterranean-style diet with whole foods and less sugar. Sleep hygiene, consistent with schedule. Reduce evening blue light. At night, the blue light can suppress melatonin production, disrupting sleep, mood, circadian rhythm. Sunlight, maximum natural light exposure, is beneficial, as is a routine. Create a daily structure and stay socially engaged. Music therapy has been shown to have very strong benefit in SAD.
So, what's the long-term outlook?
It's very good. Most people respond very well to treatment. However, without it, you're in the doldrums. It recurs every year. Follow-up needs to be done. Catch it in the autumn. If at all possible, we call it the fall. Early autumn is a good time. It can help initiate light therapy and or medicines before symptoms even start. With consistent care, prevention, lifestyle support, most patients can avoid the worst of seasonal depressions and maintain a year-round wellness.
And your mnemonic for it
is the word bright.
B stands for?
Bright light exposure in the morning.
R?
Regulate your routine.
I?
Include mood-boosting foods and vitamins.
G?
Get outside and exercise.
H?
Healthy sleep hygiene.
And T?
Track symptoms early to prevent relapse.
Thank you, Dr. Henderson, for helping us shed light on seasonal affective disorder, a serious but treatable condition. If you or someone you know feels unusually down during winter months, don't dismiss it as just winter blues. SAD is real and help is available. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, Go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.